Hello, doctors and friends. This is SGDB5, and now we are going to present our student project entitled Point Care of Testing. And this is the list of our members.
My name is Karen Angela, and my student ID number is 210251116. So, because of the time-consuming diagnostic at the central lab, back then scientists were very interested in developing devices that can give information about a patient's condition faster, cheaper, and better. Therefore, in the 1980s, they invented a smaller and simpler diagnostic technology that can be used at or near the patient, which over time become more automated, networked, and accurate. Those are then called POCT or point-of-care testing devices. Shortly, POCT is the diagnostic testing at or near the site of patient care. Some examples are blood glucose monitors and pregnancy, as well as SARS-CoV-2 antigen rapid test kit. Although they are rapid and user-friendly, they are less accurate and sensitive than those used in central lab. Therefore, in order to maintain their accuracy, proper guidance, quality assurance, and maintenance are needed.
My name is Nibana Sifa with last digit 121. Based on the background, the problem of formulations are: what is POCT? What are the devices of POCT? What are the advantages and the disadvantages of using POCT? What are the factors that can affect the point of care testing result? How to maintain POCT devices? And the objectives are to understand the definition of POCT, to understand the use of devices of POCT and its function, to understand the advantages and the disadvantages of using POCT, to understand the factors that can affect the point of care testing result, to understand the point of care testing devices maintenance. And the benefit of research are: medical students are able to understand the point of care testing more in depth as one of the basic competencies of this block. Furthermore, students are able to comprehend the definition, devices, advantages, the disadvantages, affecting factors, and the maintenance of POCT.
Thank you for the opportunity. Hello, doctors and friends. My name is Nova Indratmo, and the three last digits of my student number is 119. What is the definition of POCT? POCT, or point of care testing, can be defined as utilizing technology to analyze and medically diagnose certain medical conditions at the point of patient care or near the point of patient care. These are in contrast to traditional laboratory testing, which are highly accurate, but they demand several days and usually may require multiple patient visits. Usually, POCT can be commonly found in a physician's office, a pharmacy, a long-term care facility, and even certified sites. Using POCT allows for rapid testing, which automatically corresponds to the ability to make immediate decisions on patient care. Usually, POCT can be done bedside because it uses special instruments for more convenient testing, such as the blood gas analyzer and also the blood glucose analyzer. These instruments are more portable, they can be handheld, and they are typically more low cost. As a result, POCT is more quick, simple, and non-invasive.
My name is Madini Lamra Nirmala with last three digits of my student number 106. And now I will explain about blood glucose testing device. One of the non-POCT examination is blood glucose testing. There are several studies that use POCT in blood glucose testing, and one of those is the photoacoustic device. On this device, the presence of glucose in the blood was evidenced by the presence of a strong signal in PA cells on paper strips containing chitosan under laser irradiation with a certain frequency. Other devices which are already known for monitoring blood glucose are blood glucose meter and strips. It can be found now from basic to advanced models with various costs. These tools require central venous catheter blood, arterial blood, or capillary sample. Blood glucose in all the samples is measured for a few minutes and needs software to analyze it. However, there are several factors that affect the result of blood glucose testing with blood glucose method, for example, hematocrit.
My name is Agustin Muradinda Pratiapsa with the last 3 digits 1 and 12. So now I'm going to explain about the devices of pregnancy testing which have been widely used, such as cassette and strip. These devices detect human chorionic gonadotropin or HCG in urine by lateral flow chromatographic immunoassay method and has two windows for urine sample and the result. The result window has two lines that are the control or C lines and the test or T line. In reagent pad, urine with or without the HCG will bind to mouse anti-HCG antibodies and then flows and reacts with mouse anti-HCG on the T line and anti-mouse antibodies on the C line, and then produce visible lines. And the results interpretation can be read 2 to 10 minutes after applying the urine by see how many lines are visible. If there are 2 lines are visible that are the C and T line, it means the result is positively pregnant. But if there are only 1 line that is only the C line is visible, that means the result is negatively pregnant. And if the C line is not visible, it means the result is invalid. That's all from me. Thank you.
Doctor and friends, my name is Luis Felix Juanda with three last digits of the standard numbers 117. I will explain about the SARS-CoV-2 testings. The first one is RT-PCR, which is the common method to diagnose COVID-19, but the pandemic leads to a demand for more rapid, simple, cost-effective, but accurate tests for the diagnosis of COVID-19. There are several tests being developed. The first one is lateral flow test for measuring the neutralizing antibodies. This test only needs about 15 minutes, but have a high sensitivity and specificity. The next one is immunochromatography that is used to diagnose rapidly of COVID-19. This method that takes times about several minutes to 30 minutes, but have a lower sensitivity and specificity than the PCR method. The next one is RT-LAMP. This test is a molecular test, but have a lower cost with a simple operation method. This needs about 30 minutes from the sample collecting to the results, but have a high sensitivity and specificity.
My name is Zafira Kumbala Dewi with the last three digits of the student number is 122. Now I will continue the explanation about blood gas analyzer. Blood gas analyzer is one of the most important tests used to diagnosing and managing patients, especially patients with pulmonary disease. This device is used to analyze concentration of oxygen, carbon dioxide, and acidity or pH level in the whole blood sample. Blood gas analyzer has handheld device with LCD device, keyboard to input information, and slot to insert small tube or test strip. It also has an onboard printer to report the result. The working principle of blood gas analyzer is that this device uses electrodes to determine pH, partial pressure of oxygen, and partial pressure of carbon dioxide in the blood. The whole blood sample are placed in the tube on reaction, cuvette, or test strip, then loaded into the analyzer. Next, the operator can choose the test that want to be performed using a keypad or connected computer. There are two major types of blood gas analyzer, standalone blood gas analyzer and portable blood gas analyzer. The standalone blood gas analyzer has reagent pipes that provide reagent to measure the arterial blood gas value and sensor cassette that pack all electrodes to measure different parameters. The portable or handheld analyzer consists of simple cassettes which determine the arterial blood gas value directly. That's all from me. Thank you.
Hello everyone, my name is Grace Veronica Wijaya with the last digit of student number 11 and 3. Another POCT device that we can find is cardiac marker. So there is a disease called acute myocardial infarction or AMI, has a high prevalence and is one of the largest causes of death in the world. So we need some tools that can minimize the death of this disease. One of the tools is cardiac marker as point of care testing or POCT that can detect more accurately and efficiently.
Hello, doctors and friends. Let me introduce myself. My name is Tanis, also Tumalan Data, with the last three digits of student ID 11. Okay, so next I'm going to discuss about the advantages of POCT. As we can see, POCT definitely has a lot of advantages, such as shorter turnaround time. With POCT, turnaround time can be saved with this mobility. With this shorter turnaround time, POCT can reduce the risk of pathogen transmission due to long process of diagnosis of pathogen. The second one is that POCT is very user-friendly, not only to the doctor, nurses, and lab technicians that can operate this POCT. POCT is commercially used, which also helps for faster diagnosis time. There are a lot more of advantages that POCT packs, such as small sample size, reduced pre-analytical error, and so much more to improve the medical work.
Is Jovita Teodorelio with the last three digits 114. Now I will explain to you about the disadvantages of using POCT. The first one is less sensitive. The examinations using POCT techniques are less sensitive compared to the ones that are performed in the clinical laboratory. It has limited range and specificity and sometimes is more at risk of interference than the traditional laboratory. The POCT also has to be performed and POCT instruments have to be maintained by professionals. Common error while using POCT occurs due to lack of human resources and knowledge about POCT. Another disadvantages of using POCT are lack of quality controls and cost effectiveness due to an increasing number of analyzers and expensive reagents. Having POCT performed by the professionals means there is another added cost to hire them rather than being performed by the clinical team. Data that has been taken by the examiners from the patients can't be recorded automatically, so the data has to be input manually.
My name is Cornettel Xiaoden, and with student number 21025111110, and I'm going to discuss about the affecting factors of these POCT devices. So first of all is blood glucose testing. There are three categories for the affecting factors: pre-analytic, analytic, and post-analytic. For the factors itself, there are operator skills, hygiene, manufacturer, and this is why every strip is different for the results. And then inadequate storage, in errors in enzyme coverage, temperature and humidity, altitude, electromagnetic radiation from phones, partial oxygen pressure level, and in blood glucose testing, oxygen contributes a lot because the system that works in this testing is glucose oxidase enzyme reaction. And next is intake of ascorbic acid, which can affect the result. And last is hematocrit levels. When the hematocrit levels are high, the result tends to be lower. Next is pregnancy testing. The factors are operator skills, ectopic pregnancy, and molar pregnancy, Marshall-Smith syndrome, familial HCG syndrome, and HCG injection. And here it is clear that HCG contributes a lot to the pregnancy testing because ectopic and molar pregnancy has an elevated HCG level in the individuals. So the pregnancy testing tends to show false results. Next is blood gas analyzer with factors such as operator skills and temperature, and also high altitude. In blood gas analyzer, it only can work in 16 to 30 degrees Celsius. And last is SARS-CoV-2 testing, which we discussed in two kinds of it, the RT-PCR and RT-LAMP. In RT-PCR, the factors are sample purity and the process, which is longer and difficult, so we need a skilled operator. And also virus amount that variations between individuals can also affect the result. And last is RT-LAMP, which is sensitive, and this can be double-edged sword because it can be good and it can be bad. Why it is bad? Because it can affect in carryover contamination. The second factor is pH, and last, skilled operator. That's it from me. Thank you.
My name is Abel Manuel Senipar, with 3 last digit of number is 118. Okay, so now I'll be talking about the maintenance of the POCT devices. So the maintenance of the POCT devices is required for the quality assurance of the POCT itself, such as internal quality control, external quality control, and other important aspects of the quality controls. For internal quality control, it needs to be done by several times. Every time the operator changes, after performing some calibration, and it depends on the instrument manufacturer instruction. Okay, the internal quality control is also required if there are new reagents and if the operator itself doubts the results. For the external quality control, it's going to be carried out using the material outside the laboratory to assess the laboratory performance. The other important aspects for the maintenance of this POCT device is to understand how to use the POCT devices properly and have trained to use the machine. And also, having a knowledge on how to do the internal controls and calibrators is going to be one of the many ways on how to maintenance the POCT device.
Greetings, friends and doctors. My name is Sister Natalia with the 3 last digit student number 109, and I'm here to present the conclusion part of our student project, point of care testing. Point of care testing is a technology which allows rapid testing by non-laboratorians, and these are in contrast to traditional laboratory tests which are highly accurate but demand several days in time and may require multiple patient visits. Some POCT devices are widely known, such as glucose meters, pregnancy testing, SARS-CoV-2 testing, blood gas analyzer, and cardiac marker. Two main advantages of using POCT are shorter turnaround time, or TAT, that helps in reducing the risk of transmission within the containment area. And also its user-friendliness, which means patients and customers can operate POCT devices by simply following the instruction provided. However, there are still plenty of disadvantages such as safety errors, inspection errors, and poor quality control standards. The internal quality control needs to be maintained every time the operator changes after performing some calibration, and it depends on the instrument manufacturer's instruction, such as there are new reagents and if the operator itself doubts the result. And for the external quality control, it is going to be carried out using test material outside the laboratory to assess the laboratory performances. And the other important aspects for the maintenance of POCT devices is to understand how to use POCT devices properly and have trained to use the machine. And also having a knowledge on how to do the internal controls and calibrators. And that's all from me. Thank you.
So the suggestion is further studies of POCT devices that can continue to evolve at any time should be done. That's all from SDDB5. Thank you for watching our presentation and see you next time.